Welcome to Wasted Water, a podcast where we dive deep into the impacts of wastewater pollution and explore solutions for sustainable sanitation. With 80% of the world's wastewater entering the environment without any treatment, it's time we investigate how this issue is being tackled across disciplines and geographies. Together, we can learn from these approaches and galvanize action in the solution space for the health of people and nature. I'm Kassie Morton, your host for this episode. This podcast is sponsored by the Nature Conservancy's Wastewater Pollution Program, with generous support from Ocean Kind. Imagine a fisherman casting his lure from his favorite rocky shoreline. Hours pass, but no bites. These waters used to provide both recreation and sustenance for the local community, but now his line drags through a thick green soup of algae. The surface is motionless, choked by algal blooms caused by the release of untreated sewage from onshore. This is the hidden cost of ignoring contaminants that are flowing into our aquatic systems through untreated wastewater. This type of pollution is often overlooked or misdiagnosed, but every day across the globe, the silent crisis continues to wreak havoc at the expense of our ecosystems, food supplies, and healthcare systems, and it may be costing us billions of dollars. Researchers are beginning to understand the impacts of wastewater pollution on environmental and human health, but until recently, the financial toll on society hasn't been well quantified. So in this episode, we ask, how much does neglecting wastewater treatment actually cost us? Jasmine Fournier has been grappling with this exact question. Jasmine is a public health expert and the executive director of the Ocean Sewage Alliance, a nonprofit collaborative that brings together diverse sectors and backgrounds to tackle the issue of wastewater pollution. She reflects on how her research journey, exploring these economic consequences, started.
We have a coalition of over 65 nonprofit and researchers, and there's a very wide array of expertise. We have on-the-ground innovative work, and we have researchers, we have more traditional conservationists, and we know that sewage and wastewater pollution has extremely detrimental impacts on marine ecosystems. As we were looking across our wider network, we are hearing more and more about this gap in knowledge about how much sewage pollution is costing these various different sectors.
Jasmine's team found collaboration in Economist Impact, a think tank from the Economist periodical. Economist Impact had previously worked on economic modeling for global issues including geopolitics, sustainability, and healthcare. But in 2021, they launched the Back to Blue initiative in partnership with the Nippon Foundation to focus specifically on challenges to the ocean. Shivangi Jain, a senior economist at Economist Impact, tells us more.
Back to Blue really works to first raise awareness of these challenges and then to build a strong evidence-based case for better ocean management and protection. And so through this, the initiative really hopes to transform awareness into meaningful action for a healthier ocean.
Ocean Sewage Alliance's mission to bring attention to such an underestimated marine pollution source resonated with Shivangi's team.
In speaking with scientists and experts at the very start of this research, it became quite clear to us that while plastic pollution tends to dominate the conversation, partly because its solutions are more visible and often easier to implement, there is a lot less research quantifying the cost of inaction on wastewater, especially when you're talking about some of the environmental impacts. So a lot of existing studies focus on the human health risks. But we wanted to go further and really examine how wastewater pollution affects things like agriculture, marine biodiversity, and other vital ecosystems.
I think we often talk about the impacts of untreated wastewater in qualitative terms, but I think unless we can put a number onto that toll, it's really difficult for decision makers to really fully grasp the scale of the issue, or even to be able to prioritize it over other competing issue areas. So I think quantifying the problem in economic terms is absolutely critical. It makes the consequences tangible, and it really helps to build that case for urgent investment and policy action.
Guided by Nippon Foundation's experience with wastewater management and Economist Impact's modeling expertise, the research team set out to develop a research methodology. But first, let's all get on the same page about wastewater treatment 101. Domestic wastewater has the potential to undergo 3 levels of treatment. The first, primary treatment, removes larger suspended solids. Secondary treatment targets the smaller organic materials that remain. And the most advanced, which is tertiary treatment, further polishes the water by removing remaining contaminants, often disinfecting the water to eliminate harmful microorganisms. Sometimes, but not always, tertiary treatment techniques remove nutrients and chemicals, a step that we've learned is critical to environmental protection. Now, pivoting back to the research team, in their study, they defined the cost of inaction as the economic loss incurred by a country's failure to treat domestic wastewater adequately. And by adequately, they mean beyond primary treatment. Note that adequately treated is to be distinguished from safely treated wastewater, which the United Nations defines as wastewater processed according to national or local standards, or where those are lacking through at least secondary treatment. Scientists are learning that this definition of safely treated sets the bar too low when it comes to protecting the environment. Aquatic ecosystems require a delicate balance of environmental conditions to sustain life, and the hydrologic cycle is not always capable of withstanding the impacts of the toxic cocktail that wastewater can deliver. So tertiary treatment shouldn't be so optional after all. Without it, excess nutrients, pathogens, and chemical contaminants can degrade water quality, impair ecosystem functions, and pose serious public health risks. Now, back to Shivangi on how they quantified such a complex issue.
We approached it from a very methodological perspective. First step in developing this model was to develop a comprehensive framework, which really was informed by literature and interviews with experts, to try and map out all of those different potential channels through which untreated wastewater could have an economic impact. And then from that broader list, we then started to narrow down our focus and eventually got to fisheries, agriculture, and human health. And I think there are 2 kind of main reasons that drove that narrowing down. The first was really data availability and looking at where there was strong enough evidence to support robust economic modeling across multiple geographies. And then I think secondly, these were also the sectors where we would expect to see the most direct and significant economic impacts. So from contamination of food sources to damage to livelihoods and rising public health costs. These areas provided a representative but still conservative view of the true cost of inaction. Talking about the core of the model, which is what is the economic value of what's being lost because of untreated wastewater entering the environment and oceans? And so we approach this by estimating losses in 3 key areas. So that's fisheries, agriculture, and human health. And we used country-level data and assumptions grounded in academic literature and expert feedback. When it came to fisheries, we were looking at how wastewater pollution leads to habitat degradation, oxygen depletion, and biodiversity loss. And all of this in turn reduces fish stocks and catch volumes. So we then estimated the annual value of loss to fisheries using country-specific data on catch volumes, prices, pollution exposure, etc., to then estimate the overall economic cost. Looking then at agriculture, we focused on the use of untreated wastewater in irrigation. This leads to soil degradation and crop contamination. And then using available data on wastewater use in farming, crop yields, market prices, and other data points, we then calculated the losses in agriculture output as a result of reducing productivity and yields from contamination. And then finally, when we looked at human health, here we were measuring the economic burden of diarrheal diseases caused by exposure to polluted water. So this included the direct healthcare costs and productivity losses because of people missing days at work or children missing days in school. Again, here we drew on available data at the country level, and we used that to estimate the overall economic impact.
The research team was very deliberate in their selection of the 5 study locations: Brazil, India, Kenya, the Philippines, and the United Kingdom. Jasmine elaborates.
We convened a team of experts and conferred with them on, in addition to what data was available for the analytic team, what areas that our academic advisory board considered important. And we also looked across a range of developed versus less developed countries. So we wanted to have a variety within the case studies on type of infrastructure, lack of infrastructure, and geographic variability. As a pilot, we wanted to be able to generalize some of these data to a wider conversation. So if we had more variability within the countries, we have more credibility to say this impacts other places outside of just our pilot.
After months of planning, the team was prepared to run the model, which produced some shocking numbers. For these 5 focal countries, the fisheries sector experiences annual losses ranging from $500,000 to $2.2 billion due to reduced fish populations caused by wastewater contamination. The agricultural industry experiences annual losses ranging from $460,000 to $15.7 billion from crops lost to soil contamination from irrigating with untreated wastewater. And lastly, annual human health expenses range from $14 million to $246.7 million, from healthcare costs and lost workplace productivity due to illnesses related to contaminated water consumption, particularly diarrhea. The losses vary widely by country and pathway, but can be considerable. In Brazil, for instance, inadequate treatment of wastewater used in irrigation leads to a 4% drop in potential crop value. Meanwhile, India and Kenya are seeing over 5% losses in their fisheries sectors. These countries also face higher healthcare costs due to waterborne illnesses like diarrhea. Even in the UK, where wastewater standards are generally high, there's growing concern over untreated sewage spilling into waterways during storms, posing a serious threat to aquatic life and fisheries. While these figures are striking, they only tell part of the story. Due to modeling and data limitations, Shivangi explains that these estimates are conservative, capturing just a subset of the total potential losses.
Capturing the full scale of economic loss from wastewater pollution in a single model is both impractical and also infeasible. And so that's why our model focuses on the impacts that are likely to be the most significant or where robust data is available to really support meaningful estimates. But across all of those 3 areas, I think there are important dimensions that we don't actually quantify. So, as an example, in the ocean pathway, we are focusing specifically on fisheries. But other sectors like tourism are also highly vulnerable to wastewater pollution and ecosystem degradation. And we don't actually capture that in our model. Similarly, if you look at the agriculture model, we estimate losses based only on the top 3 crops produced in each country. But this then leaves out broader impacts across the entire food system. So if you think about other smaller crops or indirect losses because of reduced exports or food insecurity because we're producing less domestically. So again, that's not captured in our model. And then on the health side, we're quantifying the burden of diseases linked to E. coli contamination. But untreated wastewater can also carry a range of other pathogens with other serious health consequences, again, that we don't look at. So overall, our model offers a conservative estimate. And we would say that the actual economic losses are almost certainly much higher than what we're presenting.
The researchers' final report, which is called The Scourge of Untreated Wastewater, the Economic, Environmental, and Human Costs of Inaction, captures more than just the numbers. They discuss how wastewater pollution isn't just an environmental issue. It's also a product of social inequality. The harshest impacts tend to fall in the lowest income communities, especially those without access to proper sewer systems or safe water treatment. Women are especially vulnerable as they face health risks from contaminated water during household tasks and childbirth. Governments have responded by developing regulations and expanding treatment infrastructure. And on the ground, sanitation practitioners are piloting creative approaches, like in India, where reforms for water pricing are helping shift behaviors and improve access. And in Kenya, where decentralized treatment systems are gaining traction in urban areas. To learn more about how wastewater impacts economies on a local scale, we'll take a closer look at Kenya, where 41% of the population lacks access to safe sanitation, an improvement compared to Africa overall, which is at 74%. Lindsay Stradley, one of the advisors to the Kenya case study in the report, shares her insight. Lindsay is a co-founder and executive director of Fresh Life, a nonprofit which provides guidance and partnership for sanitation operators in Kenya and throughout Africa.
Kenya faces really significant challenges with wastewater pollution, as the report highlights. And this is particularly true in urban informal settlements and where conventional sewer systems are generally inaccessible. So unmanaged waste often ends up in rivers and other water bodies. This threatens ecosystems as well as livelihoods and public health. So we think Kenya was a great option for the case study due to the urbanization challenges, as well as some of the innovative approaches that really demonstrate scalable and inclusive sanitation models.
Lindsay echoes the sentiment that these downstream impacts manifest in ways that are not easily measured, but have real repercussions.
Access to safe sanitation has profound economic implications, as the report clearly highlights this macro level. And as we, in our work at Fresh Life here in Kenya, kind of zoom in on the communities that we serve, we can see that this impact stems from productivity losses due to illness, premature mortality and healthcare costs. We also see very tangibly when there's poor sanitation options in schools. Girls miss significant, often several days every month of school, and children in general often are less likely to go to school. So you can then imagine the kind of knock-on effects that we see of kids not attending school and the localized economic impacts for their families. On the flip side, when you provide great sanitation, then we see, the communities where we work, that has really transformed the economic potential of those neighborhoods, creating healthier, visibly cleaner, more thriving communities. So our contribution then was to highlight the human impact of wastewater pollution, bringing stories from the communities that are affected by these challenges, as well as the transformative potential of safe sanitation systems. So at Fresh Life, we are addressing sanitation gaps through a range of non-sewered sanitation solutions, particularly called container-based sanitation services. This is affordable, sustainable, scalable, non-sewered options. So this toilet network basically then ensures safe waste containment and daily collection. We then convert that waste into valuable end products like organic fertilizer, renewable energy, and insect-based protein for animal feed. Also importantly, we work really closely with local governments and utilities, as well as then the national government on the policy side, to make sure that not only we as Fresh Life can scale these solutions, but more generally that the policies and the regulatory frameworks support this kind of circular economy approach that we think can really immediately improve sanitation services and wastewater management in urban and peri-urban areas throughout Nairobi and Kenya and beyond. So Fresh Life, our container-based model, is an example of how innovation can transform challenges into opportunities. So by integrating technology, data, and a circular economy approach to that waste reuse, and we not only ensure that sanitation access, but then also flip that into economic opportunity.
Lindsay's story reflects a core belief of the Ocean Sewage Alliance, that is, to turn economic loss into opportunity. The research team sees this report as a starting point. Now that they've created a model for estimating losses, They've laid the groundwork to explore the concept of calculating the return on investment of effective wastewater management. Shivangi explains.
So now that we've quantified the economic losses associated with inaction, we've also essentially created a baseline for understanding the potential benefits of action. So if governments and funders were to invest in infrastructure and governance, those economic losses that we've calculated could be reduced or avoided entirely. I guess to calculate the return on investment, for us, the next step would be to really integrate the financial costs of intervention. So, for example, the capital and operational costs of building and maintaining sewage and treatment infrastructure, and also the additional costs of governance and monitoring. And then by comparing those costs to those avoided losses across fisheries, agriculture, human health, we can then estimate the overall economic gains or the return on investment. I think this approach would really help decision makers not only see the urgency of the problem, which we've already demonstrated through the cost of inaction, but also provide that economic or financial case for action and really help prioritize where investments would yield the greatest returns, especially in countries with low treatment rates and with high exposure to wastewater impacts.
Jasmine chimes in on how this study has paved the way for future research opportunities.
So this first step gave us the model, but it is just a pilot. This gives us work to build upon with more countries and with, say, larger regions, perhaps the Caribbean or in Asia. I think that we learned a lot with this first study, and as often as research goes, with more answers, we have also more questions. And I think we'd like to look into the possibility of creating a model around some of the other benefits of treating sewage and wastewater pollution, such as healthier marine ecosystems like seagrasses that then can sequester carbon better without having that nutrient pollution and other pollutants from sewage and wastewater. Because what we're trying to tell a story about is, okay, what's the return on investment and how can we drive investment dollars to sewage and wastewater infrastructure? Can we do more work around blue bonds or other financial incentives to invest in this? And I think Lindsay described it really well, talking about circular economy. So can we bring more attention through research to the benefits of that? You know, what is the economic return of employing people like Lindsay does at Fresh Life? How many jobs were created through that program? I think that we can look into that so that for why this is a good policy and investment area.
Wastewater pollution afflicts many more countries and in more complex ways than the findings in this initial study capture. But it successfully communicates the economic significance and urgency of this crisis and highlights the need for adequately treated domestic wastewater. Stay tuned as this collaborative team further uncovers the economic ripple effects of untreated wastewater and what we can do to turn the tide. Thank you for listening to this episode of the Wasted Water Podcast. If you'd like to be a part of the solution to wastewater pollution, we encourage you to learn more about the environmental impacts of wastewater pollution by visiting the Ocean Sewage Alliance Knowledge Hub and the Reef Resilience Network's Wastewater Pollution free online course and webinar series. And don't forget to check out the incredible work of our interviewees. Links to their projects and other resources cited during the episode can be found in the show notes. We also invite you to subscribe and share your questions and comments with us on our social @WastedWaterPod. Until next time, let's continue to explore innovative solutions to addressing wastewater management to protect people and nature. This episode was made possible by our listeners, Jasmine Fournier from Ocean Sewage Alliance, Shivangi Jain from Economist Impact, and Lindsay Stradley from Fresh Life, and through generous support from Oceankind. Post-production services for the Wasted Water podcast were provided by 2 Aspen Audio.